Welcome to another segment of Know Your Health, brought to you by Lee Pitts and Lee Pitts Live, and hosted by me, yours truly, Nadine Singh, the Executive Director of Premier Mobile Health Services, your not-for-profit organization making healthcare accessible for all. You could call us here, right here at 10676 Colonial Boulevard, right at the corner of Tree Line and Colonial in the Walgreens Shopping Center. 239-288-7949. Wow. Thank you for watching another topic of Know Your Health. And this week's topic is high blood pressure. Now, how many of you at home sitting there with high blood pressure? Are you taking your medication? What is high blood pressure? High blood pressure is when your blood pressure, the force of your blood pushing against the walls of your vessels, is consistently too high. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to blood flow in your arteries. The prevalence of hypertension, nearly half of the United States, that is 47%, or 116 million, have hypertension. Hypertension increases with age. For example, 22.4% between the age of 18 to 39 has high blood pressure, and another 54.5% has high blood pressure between 40 and 59, and 74.5% with age 60 and over. Hypertension is the major risk factor for cardiovascular disease. 3 episodes ago we discussed cardiovascular disease. Lowering your blood pressure is important. Lowering your blood pressure has shown to decrease the incidence of stroke, myocardial infarction, heart failure, paralysis, and the whole walks of cardiovascular disease. Some risk factor for you developing a high blood pressure include, of course, elevated blood pressure, unhealthy diet, physical inactivity, the sedentary lifestyle, obesity, too much alcohol, tobacco use, and of course, genetics. We know this is the one area that we cannot fix if many of us, father, mother, has the history of high blood pressure and cardiovascular disease, and so we have to do the right things to prevent us from developing it. And even though we do, oftentimes we still develop high blood pressure. Some signs and symptoms of high blood pressure include severe headaches, nosebleed, fatigue or confusion, vision problem, chest pain, difficulty breathing, irregular heartbeat, and blood in the urine. Diagnosing high blood pressure, this is usually done with your healthcare provider. Maybe a one-time routine screen may show an elevation of 140/90 or greater, and may tell you to go home and record the blood pressure, to keep a journal, because at least we need more than one reading of a high blood pressure. Normal blood pressure is 20/80. Stage 1 hypertension is classified as systolic pressure 130 to 139, with diastolic between 80 and 89. More severe hypertension, which is stage 2, is systolic greater than 140 and higher, with blood diastolic greater than 90. So, going back to that home monitoring form, your provider will tell you, go home, record your blood pressure, different interval in the daytime, and keep a record of your blood pressure, because this is what he or she will use to say yes or no that you have elevated high blood pressure, and indeed the diagnosis of hypertension. Prevention of high blood pressure include diet, exercise, of course, eating a heart-healthy diet, reducing your sodium intake, avoiding processed food and cooked meats and all those things that has high salt content, eating a healthy diet with less salt, getting regular physical activity, maintaining a healthy weight or losing weight, if you're overweight, limiting the amount of alcohol you drink, and if you do have high blood pressure and is not lowering your blood pressure is not attainable by this dietary modification and the exercise, of course then we have to give you therapy. And the first initial line of therapy is usually for hypertension is a thiazide diuretics or a calcium channel blocker. Plenty of our provider goes to ARBs or calcium channel blocker. And then in the second stages of the hypertension, this is when one blood pressure meds or two is not successfully treating your blood pressure. We go to stage 2, we go to having two blood pressure or 2 or 3 blood pressure regimen on your formulary to take care of your hypertension. High blood pressure is a serious medical problem. Oftentimes, we don't know that our blood pressure is elevated. It's not until we have the headache or we go in for a routine physical or something else happened and we had to see our provider. And of course, we do the vital signs and we have that first reading that your blood pressure is high. You want to know what your blood pressure is. You want to at least screen once or twice a year. And if you could do more times a year, that is better for your health. Knowing your health is important. High blood pressure leads to heart failure, cardiovascular disease, kidney failure, end-stage organ damage. You could have kidney failure, ending up on dialysis. Hypertension is, and I will always say this, it's the silent killer, and it's the number one cause of cardiovascular disease. Know your health. Once you, and of course, yours truly, Deanie, the nurse practitioner, right here wants you to know and understand the importance of checking your blood pressure bi-weekly, annually, monthly, however you want to do it, because knowing saves your life. This segment of Know Your Health was brought to you by Nadine's Adult Family Care Home, your adult family care home. If you're looking for that place to put your loved one, you could call them at 239-645-2686. If you have your aging parent at home who can no longer take care of themselves and you're looking for that comfort, loving place to put your loved one, again, that number is 239-645-2686. Thank you for watching another segment of Know Your Health, brought to you by Lee Pitts Live. Stay tuned for the next Lee Pitts Live.
Lee Pitts Live is a Lee Pitts Enterprise production.
Hello everybody, this is Lee. I'm so glad that you watched that particular show, and if you enjoyed that show, we got other shows like that. Just subscribe to our YouTube channel, watch Lee Pitts Live on demand anytime, and also hit us up on all our social media platforms. Just type in Lee Pitts Live, and there you go.